Here's something that might surprise you. Dangerous drug combinations are not only found on street corners, they're also found in medicine cabinets across the country, prescribed by well-meaning doctors. I'm Dr. Fergal Armstrong, and today we're talking about a silent killer that's claiming many lives. Let me paint you a picture from my clinic. Patient comes in, chronic back pain, anxiety, trouble sleeping. 3 different doctors, 3 different prescriptions, an opioid painkiller, a benzodiazepine for anxiety, and pregabalin for nerve pain. Individually, each has its place, but together, we've just created a potentially lethal combination. 2 groundbreaking studies, one from North Carolina spanning over a decade and another from Australia tracking nearly 38,000 people, have revealed something truly alarming. When opioids and benzodiazepines are used together, the risk of fatal overdose increases tenfold. That's not 10%, that's 10 times the risk. But here's where it gets more concerning. The Australian study found that when you add Gabapentinoids, medications like gabapentin and pregabalin, into the mix with opioids and benzodiazepines, overdose risk increases to more than 6 times higher than using no medicines at all. Now, in my time working in addiction medicine, I've seen this pattern repeatedly. These aren't people seeking a high, they're patients trying to manage legitimate pain, anxiety, and other conditions. The North Carolina study found that 80% of people on opioid painkillers were also prescribed benzodiazepines. 80%, that's not an exception, it's become the rule. Here's what's happening in your body. Opioids slow your breathing. Benzodiazepines slow your breathing. Gabapentinoids, you guessed it, they also depress your respiratory system. Stack them together and you're essentially telling your brain to forget to breathe. And here's the terrifying part. Naloxone, the overdose reversal drug we carry, only works on opioids. It won't reverse benzodiazepine or gabapentinoid sedation. The dose-response relationship is equally sobering. The North Carolina study tracked people across a massive range of opioid doses and found something crucial. There's no safe threshold. Risk increases gradually from low doses all the way up. At doses of 90 to 199 milligrams of morphine equivalent per day, mortality risk nearly doubled. Above 200 milligrams, the risk kept climbing. And this is crucial. There is a ray of hope in these findings. The Australian research revealed that for people with opioid dependence, being enrolled in opioid agonist treatment, that's methadone or buprenorphine programs, dramatically reduced the mortality risk associated with these medicine combinations. In some cases, the protective effect being in treatment essentially neutralized the added risk. So here's what this means for you. First, if you're taking opioids with any sedating medication, benzodiazepines, gabapentin, pregabalin, even alcohol, you need to have an honest conversation with your doctor. Second, never combine these medications without medical supervision. And if you must take them together, make sure someone in your household has Naloxone and knows how to use it. Third, if you or someone you love struggles with opioid dependence, medication-assisted treatment isn't just helpful. These studies suggest it could be life-saving, even when other medications are necessary. The combination of opioids, benzodiazepines, and gabapentinoids has become medicine's perfect storm. Common, deadly, and largely preventable. Knowledge is your first line of defense. I'm Dr. Fergal Armstrong. Stay informed, stay safe, and if you find this valuable, subscribe to MedHeads.